I am Dr. Tarun Praharaj, Senior Consultant Cardiologist at Birla Heart Research Center. It is very important for us to know what is hypertension. Hypertension is something when the blood pressure is more than normal. It can be further subclassified under two headings. One is primary hypertension, the second one is secondary hypertension. Primary hypertension is something which we know as essential hypertension, and where 90% of people suffering from high blood pressure where the cause is not known, that is known as primary hypertension. And the secondary hypertension when the cause is known, so we can treat the cause and we can cure hypertension. Let us concentrate on primary hypertension, which is known as essential hypertension, when the blood pressure in the range of 120 to 129 systolic and the lower limit is in the range of say 70 to 80, that is normal blood pressure. So when the blood pressure goes beyond 130 to 139 systolic and diastolic in the range of 80 to 89, we call it stage 1 hypertension. And stage 2 hypertension when the BP is more than 140 systolic and diastolic is more than 90 millimeter of mercury, that is stage 2 hypertension. And hypertensive crisis when the BP is more than say 180, 190 and the diastolic is more than 110, 120. So now these are the three classifications. Now what is important that if the blood pressure is within normal range, say in the range of 120 to 129, you don't require any medicines. You can go on medical therapy. Without medicine, you can continue having proper diet and regular exercise. BP will be always under control. When the blood pressure within normal range, say 120 to 129 and diastolic in the range of 70 to 80, that's a normal BP, doesn't require any treatment. So anyone above, anyone with a blood pressure of more than 130 in the range of 130 to 139, that we call it mild hypertension. That also can be controlled with proper dietary advice and proper exercise. It doesn't require medication. But if it is always beyond 140 and diastolic is always beyond 90, that needs medication. But what I have seen in many of our patients, those who come for hypertensive treatment, once the BP is controlled, they discontinue taking medicine. That is also not right. BP medication should be taken in consultation with his cardiologist. Time to time he should check the blood pressure. If it is within normal range, that means because of medicine only it is under control. So he should not discontinue. Medicine can be discontinued only when there is a crisis situation, like someone who has got diarrhea, dysentery, or someone has a fever, or someone has a vomiting spell. That day he should not take medicine for blood pressure. He should not take, and maybe after 1 or 2 days when the disease process is controlled, then he can resume the medication. But he should not continue taking medicine when there is a problem, other issues. Now, hypertension, how it affects heart? Because hypertension, if it is not properly controlled, the heart muscles become gradually thick, and we call it concentric left ventricular hypertrophy. Thickness of the heart muscle can give rise to varieties of problems that includes also heart failure, and high blood pressure, if it is not properly controlled with medicine, it can give rise to also cerebral stroke. Unfortunately, in our country, there is a very large number of people suffering from cerebral stroke because of uncontrolled hypertension. And many of our patients, those I have seen, that they come for checkup, the BP is say in the range of 120, 180, 190, but they don't know because they don't have any symptoms. So ideally, if someone has got a strong family history of hypertension, he should have a regular BP checkup from very young age, from the age of 30, 35. But someone who doesn't have any family history of hypertension, they should also have a regular BP checkup. Many times when you go for routine checkup, for eye checkup or some other investigation, you suddenly find the BP is very high. So this asymptomatic group of patients, those who have high blood pressure, they need to be treated more aggressively than someone who has got symptoms. What are the symptoms of hypertension? Number 1, breathing difficulty while walking, or headache, or neck pain, or sometimes they have jaw pain, or sometimes they have palpitation, short of breath and climbing staircase. So these are the symptoms of hypertension. But since in our country we have seen so many patients suffering from cerebral stroke, so even without symptoms they have this complication. So it is very important that we should have a regular BP checkup. Once the BP is under control, then you can prevent cerebral stroke, you can prevent heart failure, you can prevent heart attack, you can prevent kidney failure, you can prevent eye complication of uncontrolled hypertension like hypertensive retinopathy, we call it. So this is something preventable, and I would like everybody to be more aware of this fact, and one should have a proper regular BP checkup even from young age.